Hello, dear colleagues. I'm going to tell you about distortion of the maximum norm of the thyroid volume, as well as about the real values of the volume concerned. Specialists of ultrasound diagnosis and endocrinologists all over the world appear to consider that the normal volume of the thyroid gland should be up to 25 milliliters for men and up to 18 milliliters for women. On the other hand, during many years of research and practical activity of our Ushakov thyroid clinic, we have been dealing with quite different values. Usually, the thyroid volume amounts to about 10 milliliters in men and 8 milliliters in women. Why then is there a contradiction between the real findings of studies and the normative values from scientific publications? We decided to reveal the source of the known to specialists values of the maximum norm of the thyroid volume, differing from the actual one nearly 2.5-fold. For this purpose, we carried out a study with the resulting article entitled Distortion of the Maximum Norm of Thyroid Volume in Adults. It saw its publication in Russian in 2016 and in English in 2017. First of all, we revealed the primary sources that became the ground for 25 and 18 milliliters as the highest norm of the thyroid volume for men and women, respectively. These turned out to be publications of German specialists in 1986 and 1988. The year of 1988 saw the publication of an article by Dr. Ushakov et al., which was a very brief review of ultrasonographic diagnosis of the thyroid gland. The article contained a tiny table indicating the values of 25 and 18 milliliters known to the majority of physicians as the norm for men and women, respectively. However, the authors provided neither explanations nor proof based on which namely these values had been chosen. The only substantiation of such normative values became references to previous publications. After studying these articles, only the findings of Dr. Ushakov in 1986 turned out to be nearest to the known 18 and 25 milliliters. All other publications contained the thyroid volume values considerably exceeding these norms. In their article of 1986, Ushakov et al. Demonstrated that studying a total of 303 citizens of Sweden, with sufficient concentration of iodine in urine and normal level of TSH resulted in determining the maximal volume of the thyroid gland, amounting to 25.2 milliliters in men and 20.6 milliliters in women. Ushakov et al. In their article did not explain how the revealed in 1986 value of 20.6 milliliters as the maximal norm for women changed into 18 milliliters in 1988. This little oddity caught attention but turned out to be not most impressive. I draw your attention to the columnar diagram given in the 1986 publication of Ushakov et al., i.e., the article based on which the values of 18 and 25 milliliters were determined as the maximal normative value of the thyroid volume. The x-axis shows the thyroid volume, the y-axis shows percentage of the number of men and women included into the study. Gray-colored are the columns corresponding to the sample of people from Sweden. This diagram reflects the distribution of the thyroid volume jointly for men and women, demonstrating a non-parametric distribution of the sample. According to the findings of the article of Ushakov of 1986, the average thyroid volume turned out to be 7.7 milliliters for women and 11.1 milliliters for men. Please note that the same thyroid volume is encountered most frequently in reality. This average volume almost absolutely corresponds to the conclusions drawn in our clinic. What is next? It may be supposed that the authors of the study evaluated the sample of people from Sweden as those with a healthy thyroid gland. Therefore, they tried to embrace the whole sample with 3 standard deviations, summing them up with the average value. It had to be done due to incorrect distribution of the thyroid volume in the sample. In parametric distribution, for nearly complete coverage 2 standard deviations would be sufficient. Yet another reason why Ushakov et al. Selected the formula mean plus 3SD was, probably, standardization of using such calculation. Seemingly, The mentioned formula would have embraced all people with a healthy thyroid. But pay attention to the number of subjects included into the third standard deviation. It is only 3% of people. For women, these 3% correspond in reality to 20.6 milliliters. For the remaining 94% of women, the volume is less, i.e. 16.3 milliliters. Is it then correct to assess the volume in 94% by the values found for other 3%, if the difference of this volume amounts to 24%? Of course not. Since these 3% include an additional quarter of the volume value. The same refers to the second standard deviation. In the sample from Sweden it embraced only 7% of subjects. If summing up the third and second standard deviations they would amount to 10% versus 87%, mean plus SD. These 10% correspond to additional 8.6 milliliters in women and 9.4 milliliters in men. That is, 10% of people include 42% of the total value of the volume. Could it be in such a case correct to assess the thyroid volume in 97% of people by the values found for 10%? This discrepancy is appreciable not only in calculations but also visually on the diagram where I had to mark in a red background the mentioned 10% of people. Both third and second standard deviations distort the normal volume for a great number of people. The distortion revealed is based on an assumption that all people from Sweden examined by Ushakov et al. 1986, have a normal thyroid gland. In fact, analytical studies in our clinic demonstrated the following. The thyroid volume in people in the second and third standard deviations is excessive due to pathological hypertrophy of thyroid tissue. This phenomenon is caused by pathological compensatory overstrain of the thyroid gland. Why is it so? First, it is apparent from calculations. Could really 3% of people of the third standard deviation have healthy enlargement of the thyroid volume by 24% more as compared with the remaining 94% of people? Has pathology not been indicated by deviation of thyroid volume by 42% in 10% of people representing the sum of the second and third standard deviations, as compared with the remaining 87% of people? These considerable deviations should attract attention of researchers. They should be scientifically explained. But this substantiation was not done by Ushakov et al. Second, the main criteria in determining health of the thyroid gland in the study by Ushakov et al. 1986, were only two parameters, the amount of iodine excretion in urine and TSH value. In my opinion, these two reference points are insufficient for determining lack of a pathological condition of the thyroid gland. Why? It has been confirmed that an increase in the TSH by more than the 50th percentile from the norm is a sign of initial excessive overstrain of the thyroid gland. But in the study of Ushakov et al., there was no indication of the number of people with a small increase in TSH. Besides, studies have confirmed that pathological hypertrophy of the thyroid gland may occur in normal urinary iodine concentration. Third, it may be supposed that Ushakov et al. Failed to have correctly revealed pathological alterations during ultrasonography. Certainly, this circumstance had a technical limitation, but it contributed to an erroneous conclusion of the authors of the study. It was difficult or impossible to determine the initial signs of pathological overstrain of the thyroid gland by ultrasonographic equipment in 1986. To such signs belong enhanced blood circulation during CDM or red, contouring of lobular segments, poorly pronounced diffuse hypoechogenicity of tissue, small hypoechogenic inclusions in lobular segments, etc. That is why so probable and real is a mistake of Ushakov et al. In their assessment of a healthy condition of the thyroid gland in the sample from Sweden and their conclusions concerning the maximum normal value of the thyroid volume. According to the findings of our clinic, it is reasonable to determine the population-specific maximum of the thyroid volume according to the formula mean plus SD, wherein one standard deviation from the mean is a natural compensatory buffer. This additional small increase in the thyroid volume occurs in natural activation of the basal metabolism in case of sufficient compensatory reserve of the thyroid gland. It occurs in the period when the body requires more calories, in winter season, during menstruation, during pregnancy, etc. If the thyroid gland's compensatory reserve is significant, then even in the mentioned cases its volume does not alter substantially. This circumstance has been confirmed by the findings of studies of European specialists. If compensatory possibilities of the thyroid gland are insufficient, then in unfavorable conditions the gland has to more intensively activate its tissue, involving a greater number of its elements. In this case hypertrophy would be pathological, and enlargement of the thyroid volume would be referred to as goitre. For detailed narration and conclusions concerning the revealed distortion of the maximum norm of the thyroid volume, you are referred to the article published as a booklet and made freely available at the sites of our clinic. In conclusion, I would like to express my gratitude to all researchers having studied the thyroid volume. Only owing to their efforts we now have a possibility to get indispensable points of support for improving our knowledge. Nevertheless, real science requires a rational revision of obsolete data and appropriate correction thereof. It is erroneous to leave contradictions unnoticed. Once reasonably unimproved, errors would tend to accumulate and their results would tell on the quality of medical care for real patients currently waiting for timely provided restorative care from us, clinicians. Thank you for attention, wishing sound health to you and your patients.